Hello parents, this is Dayna. Today I'm going to talk about collaboration of therapy team and school and home. I see parental role as the manager and the bridge between all the therapists, school and main caretaker if the main caretaker is not the mom. In some cases, it could be the grandparents or helper. At some point, the main person needs to have a direction on how to stage the hours and prioritize the form of intervention according to the needs and development of the child. Each and every therapist in different areas would have their target list and IEP, which is the Individual Education Program. Parents have to choose an anchor IEP to follow. Now, during the early intervention, it is important to prep the child on sitting and focusing to learn so the child can be ready for school when he reaches school admission age. I personally use a team of ABA therapists for behavior intervention a lot and verbalization training. I also use physiotherapists to handle my child's sensory integration needs, growth and fine motor skill training. And I had speech therapists and occupational therapists for a short period of time during his early intervention period. I chose ABA IEP as my anchor IEP and inform my physiotherapists what we are working on currently, even though they might be working on different areas since their expertise is different and helping the child in different areas to develop. But if they have an idea on what the other experts are implementing, more consistency can be achieved for the child. Because ABA are usually conducted with intensive hours, while occupational therapists, physiotherapists, or speech therapists, and a lot of other intervention are just a couple of hours in a week, and it's the parental's managerial role comes in as a support for the team to work on the target consistently together. Even though I did mention about myself using ABA as the anchor IEP, however, there would be exceptional situation, and that's where parents have to come in and decide who and how to complement each other's role of the team. Example, for a child who have a lot of sensory needs, the team might want to implement a sensory diet at a certain point of his training, together for it to be effective with the occupational therapist leading the plan and timing of execution. So for this, the occupational therapist sounds like is the leader in this training. And of course, home follow-up implementation is also important to keep the consistency. The child can only consider to be learning effectively if he can start generalizing his skills learned on the table into his daily life living. And to ensure this, parents have to play a role on getting the child and applying the skill onto his daily life situation and event. This can start with applying on different therapy settings with all the therapists differently and expert help to begin. So it is then easier for the caretaker to follow up on home and get the consistency. A positive mindset leads to a positive future. This is Dayna from daynalim.com. Remember to subscribe to my channel and press the subscribe bell to see the latest videos.